Hello everyone. In this video we'll be talking about basal cell carcinoma. So it is one of the most common malignancy of the skin. So the name itself suggests basal cell carcinoma, means it arises from the basal cell layer of the skin and its appendages. 85% are found on the skin of the head and the neck region. So coming to the etiology, the main etiology which causes basal cell carcinoma is the ultraviolet radiation. The chronic exposure of the ultraviolet radiation, especially the shorter wavelength, has greater role than the longer wavelength. Chronic exposure to the sunlight, X-ray exposure, ingestion of the arsenic and immunosuppressive therapy are the most common etiological factors of basal cell carcinoma. So syndromes like nevoid basal cell carcinoma and xeroderma pigmentosa are characterized by multiple basal cell carcinoma occurring at an early age. So UV radiation can cause mutation of the p53 tumor suppressor gene. So p53 gene is the guardian genome, means guardian of the genome. So any mutation on the p53 gene can cause basal cell carcinoma. So the origin is, it arises from the pluripotent stem cell components of the basal cell. So basal cell carcinoma, so it is very easy to remember कि its origin is from the basal cell of the epithelium. Now coming to the clinical features, it occurs on the 4th decade of life. Males are more frequently affected than the females. White individuals are more frequently affected. So the characteristic site is middle third of the face or anywhere on the sun exposed skin. So basal cell carcinoma के etiology में we have read कि ultraviolet radiation, chronic sun exposure. So the middle third of the face is the most common site or the sites which are exposed to the sun. So clinical subtypes are nodular basal cell carcinoma, pigmented, cystic, superficial, micronodular, sclerosing and the infiltrating basal cell carcinoma. Now coming to the nodular basal cell carcinoma, it begins as a small, firm, slightly elevated, painless papule that enlarges and gradually develops a central depression which ulcerates, heals over and then breaks down. So nodular basal cell carcinoma means it appears as a nodular structure or a papule-like structure which begins as a small, firm, slightly elevated papule, enlarges over the time. Eventually there will be central depression which ulcerates and heals over and then breaks down. So basal cell carcinoma is also known as rodent ulcer. Why? Because if the untreated lesions, they continue to enlarge slowly over months and years with ulceration and infiltration into the adjacent and the deeper tissue. Okay, so if basal cell carcinoma is left untreated, slowly over the months and over the years, there will be ulceration and infiltration into the adjacent and the deeper tissues. Hence the name is rodent ulcer. So each may erode and cause destruction of the underlying bone and the cartilages. Metastasis is rare in the basal cell carcinoma. Now coming to the pigmented basal cell carcinoma. So the name itself suggests pigmented means pigmentation is present. So here we see a nodular ulcerative tumor. You can see in the photograph a nodular ulcerative tumor. So these pigmented tumors are caused by the benign melanocytes. Okay, so pigmentation we can see because of the melanocytes. Okay, so it is somewhat seen in the dark skin individuals. So in cystic basal cell carcinoma, we see translucent blue gray cystic nodule that mimic benign cystic lesion. So here a cystic nodule which may mimic a cystic lesion. Superficial basal cell carcinoma, here multiple scaly patches or papules that are pink to red brown in color with central clearing. Okay, we can see in the picture, see arrow marks are given. Okay, now coming to the micronodular basal cell carcinoma. So it is an aggressive type of basal cell carcinoma. It has well defined borders and less prone to ulceration. It appears yellowish white when stressed and firm to touch. Now coming to the sclerosing and the infiltrating basal cell carcinoma. These are the aggressive types of basal cell carcinoma. They have sclerotic, that is a scar-like plugs or papules. The overlying skin here will appear pale and atrophic, and the lesion is firm to palpation with poorly demarcated borders. Invasion has occurred on this patient before he or she comes aware of the problem. So sclerosing and the infiltrating type, these are somewhat aggressive types of basal cell carcinoma. Now coming to the histopathology. So histopathology also there are different types. First is nodulocystic, superficial, adenoid, pigmented, infiltrative, morphiform and the keratotic types. Now coming to the histopathological features of the nodular basal cell carcinoma. The tumor cells of the nodular basal cell carcinoma are also known as basaleoma. That is, typically they have large hyperchromative oval nuclei with little cytoplasm and they are arranged in nests of varying size. So here in the nodular basal cell carcinoma, what we see? The basal cells. The characteristics of these cells are, these cells have large hyperchromatic oval nuclei. So when we will have a large hyperchromatic nuclei, obviously there will be very little cytoplasm, and these cells, they are arranged in a nest like pattern. The cells here, they appear uniform, okay, and mitotic figures are usually few in numbers. So here in the photomicrograph we can see the basal cells, they are arranged in gnat like pattern. We can see the overlying epithelium, and in the connective tissue we can see the nests of these basal cells. The basal cells, we can see these are hyperchromatic cells. They are having a very little amount of cytoplasm. So in this photomicrograph we can see basal cells are arranged basically in a somewhat nest like pattern. The periphery of the cells of the nest show palaciding. So you can see arrow mark is given. So the basal cell which are present at the periphery of the nest, if you look carefully, we will see they are present in a palaciding pattern. They are present in a palaciding pattern. So this is one of the characteristic feature of basal cell carcinoma. So the early lesion exhibits some connection to the overlying epidermis, but such contiguity may be difficult to appreciate in more advanced lesion. So earlier lesions, so we can see in the photomicrograph, they are having the basal cell का जो nests है which are present in the connective tissue. If you look very carefully, see they are connected to the overlying epithelium. So we have read that the origin is from the basal cells of the epithelium. So the initial lesions, they will show connections with the overlying epithelium. That is, they are somewhat connected to the basal cell of the epidermis. Okay. Increased mucin is often present in the surrounding dermal stroma. So another characteristic feature of the basal cell carcinoma is retraction artifact. So what is retraction artifacts? It is a cleft formation which commonly occurs between the basal cell nest and the stroma because of the shrinkage of the mucins during fixation and staining. So we can see a arrow mark. So between the stroma, connected to stroma and the epithelial nest, we can see a clear zone. we can see a whitish zone, that is a clear zone, it is marked with an arrow mark. This is known as retraction artifact. How does it occur? It occurs because the mucins which are present in the connective tissue, we read in the last slide, due to the fixation and the staining process, there will be shrinkage of these mucins. Okay, as there is shrinkage of the mucins, a cleft like space which is known as retraction artifacts occurs between the stroma and the basal cell nests. So some lobules may exhibit areas of pseudoglandular changes and hence the name adenoid basal cell carcinoma. So glandular structures, pseudoglandular structures may be present, and when pseudoglandular structures, we can see in the photomicrograph pseudoglandular structures which are present. If pseudoglandular structures are present, it is known as adenoid basal cell carcinoma. See here in this photomicrograph we can see glandular structures within the nests of the basal cells. Glandular structures, hence the name adenoid basal cell carcinoma. Next variant is nodulocystic variants. The large tumor lobules may degenerate centrally, forming a pseudocystic space filled with mucinous debris. So in the photomicrograph we can see pseudocystic spaces, large cystic spaces. So this, if this is present in the slide, we can say it is nodulocystic variant. Next, coming to the pigmented basal cell carcinoma. Here what we see? We see benign melanocytes in and around the tumors producing large amount of melanin. So in the photomicrograph we can see pigmentation present in the slide. So these pigmentations are produced by benign melanocytes. These melanocytes may contain melanin granules in the cytoplasm and the dendrites. So if pigmentation is present, we can see the pigmentations which are produced by the benign melanocytes. Histologically we will say it is pigmented basal cell carcinoma. Next, coming to the superficial basal cell carcinoma. The name itself suggests superficial. Here what we see? We see buds of the basaloid cell arranged to the under surface of the epidermis. So if we see in the photomicrograph, what we will see? We will see buds of the basaloid cells, and these buds of the basaloid cell, they are attached to the overlying epithelium. The nest of various sizes often are seen in the upper dermis, which show typically pelaciding peripherally. Okay, these nest of the epithelium which are present, they may show pelaciding, and they are present superficially, and they are connected to the basal cell of the epithelium. Next, the more aggressive morpheoform and the infiltrating basal cell carcinoma exhibit growth pattern resulting in strands of the cells rather than round nests. So the more aggressive forms, that is morpheoform and the infiltrating basal cell carcinoma, here what we see? We see cells are present in strands rather than the round nest. So in the photomicrograph what we see? It is a morpheoform basal cell carcinoma. Here what we can see? We can see thin strands of the tumor cells that are embedded in the dense fibrous stroma. So in the other variants which you read till now, what we have seen? We have seen the basal cells, they are arranged in a nest like pattern. But in the morpheoform what we see? We see very thin strands of the cell. Very thin strands of the cell. These are seen on the dense fibrous stroma. Next, coming to the infiltrating basal cell carcinoma, this usually does not exhibit the skull-like stroma seen in the morpheoform type. Here, peripheral pelaciding and retraction are much less pronounced in. So, peripheral pelaciding and the retraction artifacts are less pronounced in the morpheoform, the infiltrating type of basal cell carcinoma. Okay. So, another variant is micronodular basal cell carcinoma. Here what we can see? We can see in the photomicrograph small nodular aggregates of basaloid cells. So here small nodular aggregates of basaloid cells we can see. So hence the name is micronodular basal cell carcinoma. So sometimes basal cell carcinoma can occur with squamous cell carcinoma, that is a collision tumor. So this type of carcinomas are known as basosquamous carcinoma. Now coming to the investigations, what we can do, some special stains we can use, that is mucicarmine, colloidal iron technique, Mauvet stain and the amyloid stains. IHC also we can do. So special apart from HND, we can also use special stains, the names of the stains. We can also do immunohistochemistry, here low molecular weight keratin proteins we can use, CD10. Now coming to the differential diagnosis. So first one is squamous cell carcinoma. Next, basaloid sebaceous carcinoma and adenoid cystic sweat gland carcinoma. So these are the differential diagnosis of basal cell carcinoma. Now coming to the treatment part, surgical excision and radiation therapy can be given. Recurrence is usually uncommon. Metastasis does not usually occur. The prognosis is good. Why prognosis is good? Because it grows slowly and does not tend to metastasize. So this is all about basal cell carcinoma. If you have liked the video, please do press the like button and subscribe my channel. Thank you.